Ozempic phase is a very trendy topic nowadays. When it happens, it usually happens when there is a rapid fat loss, and then those changes reflect on the face. What are the conditions, the symptoms, how to solve it? For all those questions, I'm very happy to be very well accompanied today by Dr. Maya Sinai. Maya, hello.
Hello, how are you?
I'm very good and very happy to have you here. Welcome.
Thank you so much. I'm happy to be here.
Let me tell you a few details about Maya. Dr. Maya Sinai is a dermatologist and Mount surgeon. Her love of dermatology surgery and aesthetics started her studies in medical illustration, where she earned a master's degree from Johns Hopkins University in Baltimore. For the past 10 years, Dr. Sinai has worked in aesthetics, general and surgical dermatology, and she has offered innovative facial rejuvenation, volume restoration, and anti-aging treatments. And currently, Dr. Sinai is running her practice for aesthetics and surgical dermatology. And she's also the fourth generation of dermatologists in her family. So let's talk about Ozempic phase. Maya, why has Ozempic phase become such a trend in the latest years?
So it's a really interesting topic. We decided recently, actually, that we would maybe not call it Ozempic phase, because now we have other medications in that class. And so it's not just Ozempic that people are actually being treated with, but we call it now medicine-derived weight loss. And so what happens basically with that is, in the beginning, it was a great treatment because it helped a lot of diabetic patients control their diabetes and lose weight. And with time, we saw actually that it did a lot of other really great things. And so these medications have become a huge industry, and lots of patients have become treated with the GLP-1. And now we see actually that these injections and these medications are causing changes in the skin and in the fat and in the faces of our patients. So what's actually happening here? The rapid fat loss that these patients will see with the weeks and the days that they start injecting will actually create a fat redistribution. And so not only in their body, but you'll see a fat redistribution in their face. And we know in the fat, there's a few different kinds of fat in the body, but fat is an endocrine organ. And when we decrease the amount of that fat in the body, we're actually also changing the hormones in our body. And so when you have, let's say for a female patient that comes to me, if she's now having a rapid fat loss, you'll see actually that it puts her skin almost into a menopause. Because now I've decreased the fat, I've decreased the estrogen that's being created and diffused into her bloodstream. And you'll see actually that her skin has become almost menopausal, so that estrogen in the skin, we know, does a lot of great things. It talks about, it deals with water absorption and hydration and the collagen deposition and the new collagen that we make. And so what happens is, once we have skin in menopause, we start to see that the skin is actually aging much faster than it has until that point. So you'll see a loss in elasticity and a decrease in water absorption. And you'll see that with fine lines and saggy, not elastic skin. And so we have this huge problem, not just with the fat redistribution in the face, but the skin itself has aging much, much more quickly than we had seen before.
And when it comes to the Ozempic phase and it arises, this rapid fat loss has certain complications in the skin. Which are the ones that you mostly see?
The main two that we see really is the loose and sagging skin that we have, that the skin has now lost its elasticity and it's much thinner, so that the collagen isn't being turned over and being made quick enough. And so you'll see just very thin faces that also the volume has been depleted, but the skin is very, very saggy and not really responding to water absorption the way we want. It's not really functioning as nice, healthy skin.
And when it comes to the treatment, now that we know already the causes, how and what is the best treatment on how to face this Ozempic phase?
So I always say that the treatment has to be patient-oriented. And so when we look at someone with medicine-derived fat loss, we look at, first of all, volume, and we look at also skin quality. And those are the main two things that we're treating. So whether we're doing that with injectables, like a biostimulator or a hyaluronic acid filler, we can combine that also with other kinds of energy-based devices that also will help us lift the skin and create a nice new collagen, a new thicker, more durable skin.
So let's go to the last question. In the case of the treatment of the Ozempic phase, are you able to combine treatments? Is it recommended? What are the results that you can have when you combine them?
Yeah, that's a great question. I love combining treatments. I think that when you're combining two products or two technologies or product and technology, you get 1 + 1 does not equal 2. It equals 3, 4, and 5 sometimes. So the range in services that you can give your patients is crucial. If you're only able to do hyaluronic acid, so that's not going to give your patient the most optimal, long-lasting results. So I really like to combine treatments. For instance, when we treat, like kind of a sagging jawline. So I like to not just add filler to the jawline and kind of create and sculpt the jawline, but I actually want to lift all the heaviness that is falling on that. And so a biostimulator is a great option for something that you actually want a long-lasting result. And when I combine that with, let's say, a HIFU or some kind of energy-based device, a laser, that will also give us a nice deeper effect for the collagen and a better stimulation of the skin.
Okay, Maya Sinai, thanks a lot for joining us in
Thank
Ozempic Face
you.
podcast.
Thank you so much for having me.
Thank you.